somebody needs to.
Somebody has to be in charge. Good morning, everyone. Welcome to our Heartland PMAD Facebook Live. I'm Kim Martino Sexton, here with Elizabeth Louder and Dr. Cypress Garrett, our guest for today. And so we're excited to be here. Elizabeth, do you want to say anything as we get started this morning?
No, I'm happy that we're all here, and I'm looking forward to talking to Dr. Garrett about all the different things that she does at the St. Louis Women's Healthcare and her doula practice that she has. So she is a woman of many, many skills and talents. So this will be an interesting, no pressure, Dr. Garrett. You are what you are, do what you do. But this will be interesting because there's lots of different points that people can ask questions about. So I think that's pretty cool. So Dr. Garrett, thanks for joining us.
My pleasure. Thanks for having me.
Yeah, so why don't you tell us a little bit about, why don't you start that laundry list of things how you help support moms in the St. Louis area?
Well, currently I have a practice where I work as a chiropractor and acupuncturist at St. Louis Women's Healthcare Group, which is an OB-GYN practice in Chesterfield. I see largely pregnant women, although not exclusively. And I really help them to manage discomfort related to pregnancy is a lot of it. It's an OB-GYN practice in Chesterfield. That's not distracting. And I really just help them through. I can work at chiropractic to help with comfort measures with all that. I also do acupuncture, which will help, again, manage some of the symptoms of during pregnancy, but I can also work with acupuncture to help start labor along if it is about ready to happen. Mm-hmm. I do tell my moms that I'm not going to be able to use acupuncture to put you into labor if you're not ready to be. Your body's not going to do it, but if you're right on that edge, sometimes it'll be the thing that pushes you over.
Yeah.
And then, I'm also a doula. So I have a fairly low volume practice there. I really only do a couple births a year. I've been doing that for, I think my oldest kid is now 17.
Oh, wow.
Yeah, for 17 years now. It's weird to me to be able to say that. I'm like, wait, he's how old? But it really has been that long. I've been doing that actually longer than I've been a chiropractor. Mm-hmm. And I really try to work with the moms who need me. And what that looks like varies. They're often referrals. Sometimes they're existing patients. Sometimes they're friends. But I really say that I don't want any mom to give birth without the support she needs. So it is often people without adequate support. Mm-hmm. During COVID, I stepped in and was a doula for one of my patients who hadn't planned on having me. She planned on having her mother there. But Mercy was only allowing a spouse, but they were allowing a professional doula. So her mother couldn't be there, so she brought me in instead, which was really kind of neat.
Yeah, I bet. So what has it been like being in the hospitals with moms who are delivering? Because we work with a lot of folks that are working with moms and want to be able to prepare them for what to expect.
Really, once you're in the room, it's no different. There are some changes that I've seen, you walk in, you get your temperature taken, you get screened, all that stuff. But once you are in the delivery room, it really is the same. Your providers are wearing more masks. They've got a little bit more on their face. But in reality, the experience of being with a mom in labor was no different than outside of COVID. Mm-hmm. Which was good to see. It was interesting. Sometimes the anesthesiologist won't let me stay in if mom decides she wants an epidural, which did happen at one point. And it was odd to be out of the room at that point because the hallways are really quiet.
Yeah.
Because there's nobody extra there. There's nobody waiting in the waiting room for babies to be born. There's nobody pacing the halls. So that experience is different. But the actual experience with moms during labor was really the same.
Yeah. Moms get to see the baby.
Yeah.
It's just a regular birth. Yeah.
Mm-hmm. Well, that's really good to hear. I hope that that's reassuring for folks out there, because I think that well, I know that there's a lot of worry about what's it going to be like there, and how reassuring to know that once you're in the room, it's the same. And so it's getting to the room that there might be some extra steps. What were the extra steps in getting into the room, if any?
For me, really, I just got screened. At the front door, they, nobody's checking, do you really deserve to be here? I did have my mom let them know that she had a doula coming. And I actually came armed with a letter from her physician saying that she considered me part of the birth team, because that's how Mercy qualifies their doulas. So I actually had a letter from the physician, if I needed it, saying she considered me to be a doula and part of the birth team. Didn't need it. Nobody asked. Yeah.
Nice.
Nobody asked. No, one of my friends who's a labor and delivery nurse told me, we can tell. We can tell if you're doing actual doula things or if you're just there kind of being an extra person.
Yeah.
And if you seemed like one of those extra people, they would probably then ask you to provide something.
Right. And when you say the screening, because I think a lot of people don't know, because most of us aren't going in and out of hospitals, so we don't know. So what is the screen like?
They take your temperature. Usually it's a forehead scan. So it's the no-touch thermometers, which read typically about a degree lower than an oral one does. It's interesting that I've been hearing my temperature. I'm like, wait, it's that low? But then you do the math and you're like, okay, no, that's actually normal for me. And then they ask you questions. Have you been in close personal contact with somebody who has tested positive or has been quarantined? And close personal contact is defined as more than 10 to 15 minutes within 6 feet. So it's not, have you passed by somebody while you're both wearing masks? Not have you been in the same building? It's really, have you had close personal contact? Have you had any of the laundry list of symptoms? Have you traveled to any of the high-risk locations? How those are phrased vary kind of by location, but those are the general questions. And do you feel well today? But it's not like there's no intense scans. There's no, you have to prove this, you have to prove that. It's really, and a lot of it comes down to honor system. It really is a matter of, you're on your honor to disclose if you have been exposed to something, if you are at risk, those types of things, which, I would like to think people are being honest about, and honest with themselves. You don't want somebody who knows that they're going to be in close personal contact with somebody for an extended period of time to be exposing somebody knowingly.
Right.
It's like you would think that the person going into the room to be with that mom would be conscious of their responsibility there.
Right. Well, again, I thank you for that. I think it's helpful for people to hear what it's like, especially our families who are heading into birth at different hospitals. And we know that different hospitals have some slightly different things going on, but everybody's screening. And so that initial walking through the door, because I've always appreciated and we've always encouraged couples to take the tour. So you have that initial get through the doors and see what it's like. That's not happening right now. And so they're not getting that initial like, oh, okay, here's what it's going to feel like. Here's where I park. And so just to have some of that, have some understanding, I think is essential in kind of shaking off some of the stress of going to the hospital.
Right. There's a lot of fear around that these days. So I think anything you can do to take that away is a good thing. Absolutely.
Well, and Dr. Garrett, I'd love to go back and talk a little bit more let's talk about chiropractic. So I want to phrase to just let you know what I'm thinking here. So in all the groups that I get to be a part of, chiropractic comes up often. And we've got, in any given group, we've got moms who have an understanding of chiropractic and moms who don't. And it's wonderful. I enjoy hearing how the moms who've experienced it and how it's worked for them, sharing with the moms who are trying to figure out something like, well, maybe I might be interested in that. And that's interesting. And so I think if you could share with us a little bit about what it's like when you're working with an expectant mom. And then I know you work with postpartum moms as well. But what does that look like? If you were to describe like the chiropractic scenario for someone who has not experienced it, how would you describe it?
Like a first visit or what a treatment looks like? What are you?
Oh, see, now I think that's important, right? Because there's a difference. And so when you initially go in to see a chiropractor, and I have to, go way back because I've been receiving care, but as I have seen them, that's right. So the first visit is, in my recollection, is a get to know you. Um, like a learning about who I am as a person, what I'm up to, and what brings me here. But talk a little bit about that first visit, and then we'll move into what happens during treatment.
Okay. And even with that, for me, I have a couple of different scenarios, but I can talk to those.
Sure.
Because I do work in an OB-GYN office, so a large portion of my patients are our office patients. So I come into the treatment room with them with a little bit more knowledge than I do if it's somebody who is not an existing patient. If it is a patient in our office, I have access to their charts because I'm a provider in that office. So I have background information on them to begin with.
Nice.
But I still ask them for their story. Which is really where I start with everybody, because what brings moms to me as a chiropractor varies. Some moms are there just because they have pain. Some moms are there because they have heard that it's good for them and they want to do everything they can to support the pregnancy. Some moms are there towards the end of their pregnancy because somebody told them I might be able to help their breech baby flip. And those are like the top three that I see. And so the conversation definitely steers around what brought them in. But regardless of that, I generally ask some of the same questions. I will always want to know what their story is and talk about their pregnancy in general. How far in depth we go really depends on how pregnant they are. If they're earlier in pregnancy, they've got a shorter story. If this is their first pregnancy, they may have a shorter story than somebody who has a fifth pregnancy. And if it is somebody who's had 5 pregnancies, I want to hear their full story, because really each pregnancy is different. Often they will have similar complaints during some of their pregnancies, but not all of them. So I'll ask, did you have this problem with your previous pregnancies? For moms who've had multiple babies, I will want to know about delivery. Did you have a vaginal birth? Did you have a cesarean? If you had a cesarean, why did you have a cesarean birth? Because there's a lot of reasons, and sometimes wanting to have a VBAC is a reason why moms will come to me after a cesarean. Just because they're like, okay, well, I want to see if I can do everything right this time around. And they realize that sometimes being right is taking care of their structural alignment, because there is definitely a relationship between how well aligned your pelvis is and if a baby's head is going to fit out of it. I will want, and then I'll ask some questions of my moms that they go, I wouldn't have thought that would be relevant. But even my mom's in our practice, because it's not necessarily in our charts, I'm going to want to know, did you play sports as a younger person? And if so, which ones? Because there are certain sports that lend themselves to certain injuries. I don't x-ray pregnant women. We don't do that. It's not safe. So what I'm really trying to do there is get an idea of what your spine might look like. And I'm going to ask if you've ever been in a car accident. And I qualify that as really any car accident. It only takes a couple miles an hour to get a whiplash injury. And people don't really realize that. They're like, oh yeah, it was just a little bump. I'm like, yeah, and I tell them that fact, and they're like, oh, well, I was stopped, but the other person was going 40 miles an hour. I'm like, yeah, okay, that affected your body. Other things I'm going to want to know, did you have a hard time getting pregnant? Because sometimes there are structural reasons for that. And sometimes those structural reasons are going to lend themselves to pain during pregnancy. Women who have things like adhesions or have had a lot of pelvic surgery will sometimes have scar tissue that leads to pain. So I really dig into some of those things that people don't necessarily think they're going to go into.
It's a real thorough history, it sounds like. Yeah.
The history is almost more important to me because my hands are going to do what they're going to do. I've been working with pregnant moms for at least 17 years in a variety of ways. I was a massage therapist specializing in prenatal before I was a chiropractor. And so my hands know what to do with a pregnant mom, but I want to know where their body's been. Sometimes as I'm working with them, or even up on the front end, depending on what brought them to me, I will ask them if they have an abuse history. Because that does often play into how their body is going to respond both to pregnancy and labor and delivery. So I do look at those pieces when it feels like it might be there. And sometimes they're like, no, I'm good. I'm like, okay, great. So your body's just feeling like this. And sometimes they go, how did you know that? And I said, because your body feels like this. It'll come up in things like anxiety or just ways that their body doesn't want to be moved. And so I really help and work with those. I make referrals out for that a lot. But so I will go through a lot of history. And then I really do a fairly brief exam. Most of the time, my pregnant moms come to me for things that are structural. The rest of the pieces come out over time. But generally speaking, I know what's going on in their body unless there's a coexisting injury. So I do a relatively basic exam, and I do treat on the first visit. I am not a chiropractor that says, okay, here's your exam. We talked a bunch. Come back tomorrow and I'll treat you. I do not do that unless there is something huge, and that's usually not the case with my pregnant moms. If there is an injury, if there's something scary, sometimes I'll be like, no, I really need to take pictures first. I don't do that with my pregnant moms. I have once ordered an x-ray on a pregnant mom, and it was towards the end of her pregnancy, and it was actually because anesthesia was going to want to know if something was there because she wanted an epidural. I was like, okay, well, we might as well do this just to rule it out. And she was fine, and they're going to be just fine with that. But it was a question of, at this point, and I did it in conjunction with her OB. I was like, what is anesthesia going to want? And what are they going to do? So that's a lot of words to say what happens on the front end.
But it's really important to know that, because people have all kinds of different ideas in their head about, what chiropractic is, based on usually a lot of false information or just lack of information. Well,
and sometimes it's actually based on previous experience. So all chiropractors are unique. We are all different. Some of us practice similar to each other, but everyone practices a little differently. And so sometimes it's, oh, my last chiropractor didn't do that. I saw somebody new the other day who was like, you've spent more time with me today than any chiropractor spent with me cumulatively. So it really is a question of, who are you going to? Some people want to walk in, get adjusted, and run back out. That's not what I do. Sometimes it is. If somebody is just coming to me for wellness care and I've been seeing them for years and they just need a quick adjustment, that's an in and out. But if it's a mom, especially if it's a newer mom to me during pregnancy, I will take the time with her. And I tell my moms, I always have time for a pregnant woman in pain. So if I tell them, if you call the office and they say, I don't have time when they can come, I tell them to ask the desk to send me a message. And my desk knows, they're like, okay, when can I work her in? And I can always find somewhere that I can put her, because there are those people that I know, no, they're going to be quick. And I can put her in with them and also give her the time she needs. One of the other things people think about when they're talking about chiropractic is, how often are you going to want to see me? And I tell them that on the front end too. I'm not a chiropractor that has solid and set treatment plans. Some chiropractors, you walk in and everybody they say, I'm going to see you 3 times a week for the next 4 weeks. And I'm going to see, I don't do that. I really base it on how your body responds, because I believe that everybody's body is different. And especially with pregnant moms, the hormones make everything a wild card. Because the hormones that make it so easy for everything to kind of go out of whack also makes it really easy for things to go back. So it's a double-edged sword. So I never know exactly how my pregnant moms are going to respond and how quickly. There are 3 options when I see my pregnant women. Either they are going to walk out the door thinking I walked on water and it's going to be fabulous. Nothing is going to happen, but over time we're going to get them where they want to be. Or now and then there's somebody that it really takes a long time, and it comes down to just managing their pain through pregnancy. They usually have underlying issues or injuries previously. They've had a spinal injury. They know they have these things going on, and it really is a question of just mitigating their pain to get them through till the end. And then typically I will see moms more often if they come in for a problem. You come in for back pain, I'm going to see you more often until we get you kind of where we want you to be. Then I tell my moms I want to see you no less often than you see your doctor, your OB. So as you are seeing your OB more often, I want you to see me more often. Because as your body's getting bigger, as you're making more changes, you're going to want to see me more often. as I support you as you go through pregnancy and get closer to the end.
And that's how wonderful for you to be right there in that office. So for a mom, she gets to see her OB, she gets to get her chiropractic care, all in the same day, which of course now is even more important.
It is. I've actually gained some patients through that who, even though there are patients of our office, they had previous chiropractors. Mm-hmm. And they're like, but I'm already coming here, so I don't have to go to another office right now to get that care. Right. So so they're like, I really can get it all right here.
It's really a wonderful model. I wish that every office had the opportunity. Having that co-located presence is so important. And again, now, but it's always been important, I think. Pregnant women, expectant moms, and new moms are busy. And so whenever we can take, another chunk out of the, especially the travel piece and the waiting piece and the lugging and the getting there piece, and it can all happen in the same space. It's awesome. One of the questions that comes up for expectant moms when they think about chiropractic treatment is, well, what am I going to do with this belly? So I've seen some pictures of people at chiropractors, and they're laying down on their belly. And so how am I going to get my care with this big old beach ball in the way? What does that look like? And so...
So all of us who do this, it looks a little bit differently. Mm-hmm. But in my office, I have a table that the belly piece, so the part that's under your belly, actually I can hit a release lever and it breaks away. And it drops down, so there's actually a space for your belly to hang. Now, that's great when you're 25 weeks, but as you get closer to that 40-week mark, your belly gets bigger. So I actually have a series of pillows that I'll stack up under mom's hips to give up just a little more lift. To give the hips more space so that belly can just hang and float freely. And most moms are able to be in that position really all the way through pregnancy. Yeah. Some of my smaller moms who happen to grow twins, sometimes we run out of space, and I do everything with them on their side and on their back. Mm-hmm. There are ways to modify everything. It really is just, sometimes it comes down to a question of creativity, really. Yeah. It's okay, that doesn't work anymore. What do we do now?
Yeah, absolutely. And then one of the things that we hear in terms of fears often is, well, I don't want anybody cracking my neck. So that's a thing that we hear. And I'm always interested in how the different moms respond to the type of chiropractic care they're receiving to that statement. And so how do you talk about that with folks?
Well, one of the first things I do is I ask them why. Mm-hmm. Because sometimes they've had that done and they really didn't enjoy it. Mm. So my personal perspective is, so if it's those moms, I talk to them. I'm like, okay, what about it didn't you like? Because sometimes it's just they had a bad experience. Mm. I tell them I can work with an activator, which is a little instrument. I don't have it with me right now. That just it sounds like a clicky thing. And I can put it directly into a joint and use that to move a joint. It's really specific and very gentle. Mm-hmm. I don't love it for the neck, but I will use it if mom really wants it. Mm-hmm. Because I do prefer to use my hands. But what I tell my moms in that perspective is, if it's that they've had it before and they don't like it, I reassure them that I don't fight with your body. So sometimes that bad experience has come from somebody really forcing their neck to move. And then they hurt later. And I have had a lot of success with moms who have had that experience with being really gentle and just kind of working their neck into a position where it just barely moves and it does what it needs to do. And they're like, oh, it can be like that.
And which I think is great to hear, like that it's gentle. So you're working with where the body is. And that's what I've appreciated about the chiropractic work that I've received from several different chiropractors, is that they have an appreciation for, where the body is, and they have an idea of where it would be helpful for it to go, but it can't always go there in the first day. And so I always talk about like, the chiropractors I've worked with are like yoga instructors and good yoga instructors. So, ones who say like, today you might not be able to be in this, position how I'm in it because I've been practicing for 20 years, but be where you can be with your body. And so chiropractors have that approach where it's not like, okay, in this one session, we're going to get your body where it needs to be. And it's been out of alignment for 40 years for, like for me, I'm 54. So if I've been out of alignment for 54 years, we certainly can't do it in one day,
Right.
but we're going to work
people
towards.
really want us to. So some people will come in thinking they have an idea of what they want it to look like. They come in, they're like, I am going to get this all done in one visit. And so I really use the comparison of braces. I talk about, did your teeth hurt before you got braces? And usually the answer to that is no.
Right.
And I say, okay, do they hurt when they get tightened a little bit? And they're like, oh, well, sometimes. I'm like, sometimes chiropractic can actually do that, and it's normal because your body's used to being over here, and we're asking it to be over here. But then the other side of that is if your teeth had a long distance to move, and your orthodontist went in and put them all back in one visit, what would happen?
Yeah.
And they
Too much pain.
Right? And everybody gets that as an image. And chiropractic is really a lot like that. It's a process. If I put everything back and some of it is where I think it belongs, and I really try to let go of that too. It's where does your body need this to be? Because, nobody's body read the owner's manual. You learn anatomy, you look at the skeleton, you look at the spine. And so you have this idea of what it should look like. But nobody's body read that owner's manual. And so it's really about what is the best I can do with this person. How do I help them be the best version of them they can be, as opposed to the best version of anybody else. So that's if they're worried because they've had a bad experience. The other side of that is a lot of people do get anxious about having their neck adjusted because they've heard horror stories. They've seen the news, they've read the reports, chiropractor gives patient a stroke. It's out there, it's the words. So, and I don't avoid that, it's out there. People are going to say it. So I might as well admit that is one of the fears. And by and large, the chiropractor did not give people the stroke. Quite often what is happening is a lot of people go to chiropractors for headaches. One of the early signs of a stroke is a headache. Quite often it is actually, they see the chiropractor when they are on the verge or having a stroke in process. It hasn't actually happened yet, but they're already working on that. And the chiropractor was the last person who touched them. And then that night or the next day they go to the ER. There are some people who do have, abnormalities in their arteries and veins in their neck. But we've also all seen the stories of people who they move their head wrong. It's not necessarily the chiropractor who does that. You could do that in your bed in your sleep.
Exactly.
Statistically, you're actually more likely to have a stroke at a hairdresser than from a chiropractor, because of the position your head is in for so long. Whereas we are really cautious about our angles and how we do things. I tell people that my malpractice for a year is about the malpractice of one of our OBs for a week, which really speaks to the safety. Because insurance companies, if they think that it's dangerous and this is a high likelihood, they're going to cost you a lot more for coverage. They have people that really look at those things. So one of the things I actually do talk about is my malpractice is pretty darn cheap for a doctor. Which really shows how safe it is.
That's a good point to make. And what I've always appreciated when, as the more I've learned about chiropractic, and I've been learning more and more since my son was 5 years old, my oldest. And so now he's 24. And so, and the benefits that we've seen over the years for our entire family. So I'm a proponent. So I'm one of those people out there saying, so have you thought about chiropractic? But I've appreciated having an understanding of why it's so important for our spine to be in alignment, which now that I have this deep understanding, I'm like, well, of course that makes sense. And I'm also, I had a traumatic neck injury a few years ago. And so I needed to be put back together afterwards, which was a couple of year process because, a traumatic neck injury, you don't fix overnight. It takes a while, but so appreciated because I can move my neck with full range, which after the injury, I could not. And I will, be very clear that Western medicine handed me a bunch of pills and said, yep, this is how it's going to be. And then, but I knew better and, worked with a chiropractor. And so, and was able to heal and not use medication. And so, so I appreciate that. But can you talk to us a little bit about how the importance of alignment and what that does for our body? And especially, obviously for pregnant women, because there's so much going on.
Right. So alignment is important for a lot of reasons. Everybody has been talking about posture for a long time. But the alignment that I'm mostly interested in pregnant women is really their pelvis, their low back and their pelvis, because you've got this head that's going to want to come out the bottom, ideally. And when the pelvis is, so really, if you're looking at the pelvis like this is the biggest space for baby's head to come in. This would be, say, if it were aligned. If it's not aligned, that space changes. And it is harder for baby to make their way through that. And sometimes when your pelvis is really out of alignment is when baby starts to find creative positions to hang out. And really that's just because it's the best baby can do in that moment.
And when babies are finding creative positions to hang out, that usually results in discomfort in mom.
Yes.
So it's really important to like that. It's like, oh, baby's creative. Great. And
right. It's two-pronged, right? A lot of people look at that as, so when I say creative positions, I usually mean baby is not in the ideal position for delivery.
Right.
That often results in baby being breech or what is considered transverse. From a comfort position, I would prefer a breech to a transverse baby because breech is still vertical.
Right.
Breech is utilizing the most space that baby can to hang out. It's still not ideal for delivery. That's a different conversation and a different problem. But transverse, I have never seen a mom with a transverse baby who is not in pain.
Yeah.
As I have this cat on my lap, I think of transverse being like, I call it the cat in the carrier. You have a cat. If anybody's ever tried to put a cat in a carrier, now they have these lovely ones that open on top. You just drop them in. But it used to be, you try to wedge this cat into a hole this big. And the thing they do is this. And every piece pushes out against the edge and you just can't do it. And that is what baby is doing in mom's pelvis when they're transverse or horizontal. And they're really pushing on all of the bony parts and spreading things apart in ways that make mom even more uncomfortable, quite frankly.
Yeah.
So, from a comfort perspective, they work tandemly, quite honestly. Baby's going to put mom out of alignment, but putting mom in alignment is going to help baby find a better position. And that is part of where I come in. That's one of the questions I get. Can you flip babies? Nope.
Yeah.
That is and I tell them that. I'm like, no, I do not do a thing with baby's position. If you want somebody to actually flip your baby, that is somebody else's license, somebody else's degree, somebody else's specialty, somebody else's malpractice. That is not my job. That is between you and your OB. What I do is I help your body to be in proper alignment so baby can find the best position.
Yeah. And that's so key. We talk about that optimal fetal positioning, and really the optimal fetal positioning comes from mom's body being open enough for baby to make the best choices they can make. And so, which is where, again, chiropractic comes in. So
it really is. And one of the things, so this is a perspective that I have that's unique to working where I do and in the way that I do, is, I work with a lot of moms. We have moms that are breech, they want a vaginal birth. Their doctors send them over to me now. It's fabulous. Some moms are like, nope, I'm good. If it flips, it flips. If it doesn't, I'll do my C-section. Fine. I really respect how every mom decides to give birth. I don't care what your choices are as long as they're your choices.
Yeah.
But for that mom who wants that baby to flip and comes to me, I have a pretty decent track record. I am not 100%, and I will tell you that I have information based on where I'm working that actually is really reassuring. A lot of the times, the babies that don't flip, there is a really good reason.
Right.
And we don't know that until they go in and they do the C-section. And this is feedback that I get because I am with the doctors that I'm with. And oftentimes it comes down to a cord thing.
Yeah. Mm-hmm.
A lot of the times, if baby's not going to flip, it's because the cord has done something weird.
Mm-hmm.
One of mine fairly recently, baby had the cord wrapped around not his neck, but his torso, and his shoulder was up like this.
Yeah.
That kid was never going to flip.
Mm-hmm. Mm-hmm. I always say in class, we don't know, like baby could be hogtied in there, and
exactly.
there's nothing wrong. They can grow and everything. They just can't come down far enough to get out.
And I tell my moms that because I've actually have the experience now of having that confirmed to me multiple times by the doctor who's done the delivery of,
Right.
yeah, no, there's no way this baby was going to move.
Mm-hmm.
And it helps because some moms are like, I failed. No, you didn't.
Right.
You know, the moms that really want that vaginal birth and, you know, they want that unmedicated birth with the lights and the music and the oils and, you know, all that goes out of the window because baby stays butt down.
Mm-hmm.
And then I'm like, but there is so often that reason, you know, whatever it is. And so I'm fairly confident at this point that if babies don't flip, there is a reason. We may never know what it was, but I have been reassured enough about what that reason is to know that there's usually a reason.
Yeah. And, you know, and go ahead, Elizabeth.
OBs that you work, you know, I know that obviously you're working closely with the OBs in your office, but, you know, Heartland works with a lot of OBs and doctors that aren't, you know, aren't referring to chiropractic, and they could be. So what are some of the things that, you know, we can tell other providers, or even if mom is having contact with any other provider in their life, and so what can we have those doctors look out for if they're pregnant, you know, patients are saying XYZ, chiropractic would be a good referral?
Well, so we just talked about straight up positioning for baby. That is an easy one and a no-brainer. Actually, our office ultrasound tech will even make the referral now herself. She's like, your baby's doing this. You should go see Cypress. And it's great. So positioning problems for sure. And more providers are starting to see that. I've actually had some referrals, not directly to me, but referrals from outside providers who are like, you should go find a chiropractor. And I'm like, okay. So, and they come see me and I say, here, bring my cards back. Because they say, you have someone, and say, no. Like, okay, go back and tell them. That's the easiest and the most obvious. But back pain, again, really obvious. And it comes down to the patient. But we should always be your top consideration. You know, some patients would really prefer to do physical therapy. Fine, they do a great job too. You know, but there are enough chiropractors out there that I'm not going to be possessive either. You know, I want everybody to get the care they need. So back pain, another easy one. Big one, and this is for pregnancy and not pregnancy, quite frankly, and probably about half my practice, maybe a third, is pelvic pain. I see a lot of pelvic pain both in pregnancy and not. And a lot of it comes down to musculoskeletal issues. Again, because I'm where I am, I have, you know, they will do all the imaging. They will do ultrasounds. They will do scans. They will do everything. They've been to the GI. They've been to their OB. Nobody can figure it. They're like, I don't know. Go see Dr. Garrett. And I can help them with their pelvic pain in a couple of visits, which is really fabulous. Yeah.
You know, it makes me think of, if you've never had chiropractic care before or during a pregnancy, after you have baby, you probably need chiropractic care, you know, and I know there are other health systems around the globe that include it in postpartum, you know, healthcare management. Like, it's just like well, of course you're going to need to see a chiropractor. You just had a 9-month pregnancy, your body's, and then boom, you know, I'm just, you know, thinking of like how weird it feels after you've had baby and you're just like, wait a minute, what is this body I thought I was used to, and everything's in a different place, and, you know.
Right. And truly, everything is easier to fix closer to the injury. And pregnancy, while it is normal, it is natural, it's an injury. You know, it is, your body goes through a lot of changes really rapidly. And it is a lot easier to help mom heal and recover closer to when that happened, especially because she's still got those hormones running in her favor. You know, I can still use those to help guide her body back where it wants to be, as opposed to her body ending up stuck in a different position 2 years later because she never had the care she needed.
So yeah, it's like, even if mom has an unremarkable pregnancy, everything is great, delivery is great, it's still just a comprehensive, like, well, woman, like, I wish it was part of the expected, care for.
So do I. But it's not. And it's interesting because, I've got so many soapboxes here. I will pick one. One of the questions that I ask also pertain, you said if it's a normal pregnancy and a relatively uneventful delivery, sometimes mom thinks the delivery was uneventful till I start asking questions.
Yeah.
And often, again, if mom had a natural delivery, she usually knows how eventful or uneventful it was. But they don't all do that. If you've had an epidural, you may think it was uneventful.
That's trauma.
But, and the epidural aside, you don't know what has happened to your body below the waist.
Yeah.
Right.
Sometimes, and I don't judge this, sometimes it's just what has to happen.
Totally.
But, sometimes your knees end up places they might not end up if you didn't have the epidural. And sometimes that's because baby really needs a little more space, and they are doing everything they can do to get that space. But you don't necessarily think of what that's going to do to your pelvis, your low back, and everything else afterwards. Because you don't feel the pain of it happening.
Right.
So things that happen under anesthesia, you don't know happened. And so sometimes it's a matter of putting things back together. So I'll ask mom, I'm like, so where were your knees? She was like, oh, well, they were way up by my ears. I'm like, yeah, can you put them there now?
Yeah.
She's like, well, no. And a lot of times that's some of that pelvic and low back pain after birth comes from too, is just positions mom was in, whether she put herself there or somebody else did, to help this baby work its way out.
And I think that's a key. Like, it's similar to how we talk about mental health. Like, you don't have to be in tons of pain to get support or deserve support. There can be that things went well, but things feel just a little bit off, and you deserve that support. And when we think about, because it's so interesting to me how we talk about labor and birth in this country, where it's like, oh, well, women just do it. And they do, because we're incredibly strong and resilient, and we still deserve care for our body as we move through the process. So it's almost been talked about like it's an either or. Like, okay, well, if you had something traumatic happen, go get help. But for all the moms who don't even know that something was traumatic until sometimes years later, wouldn't it be wonderful if she, had that holistic look at her body and that care, and it was just rite of passage? After the baby's born or during pregnancy, you establish relationship with a chiropractor, maybe even a physical therapist at the same time, and and you have this whole team. Because we shouldn't have to wait until we're like, I can't function anymore to get help. It should be part of this wellness whole perspective.
It should. And actually, one of my bigger perspectives is I care about mom. There are like literally dozens of people who care about mom because she is a vehicle for this baby. Yeah. And when, right? And so she goes through all this 9 months, she carries this baby, and she births this baby in whatever way it looks like. And suddenly there's a baby, and she is expected to be done and care for this baby. And it's almost like, everybody cares about her because of the baby. My focus is mom. There's like 3,000 people taking care of that child. I'm not worried about that baby. I really want to make sure that she is supported through her pregnancy, through her postpartum, and as a mother. Kids, yeah, she's got the kids. Other people have the kids. If there's a situation where I'm worried, okay, I'll worry. But for the most part, I worry about mom, because so often she's the one not getting the support she needs, whether it's physically, whether it's emotionally. And I'm seeing that actually a lot of that right now. We say it takes a village to raise a child, and we've said, okay, now everybody leave your village outside your door.
Yeah.
And, so one of the things that I've actually really enjoyed is I'm part of that village right now. Moms are like, I get to come see you. I had somebody the other day say I was the first person other than her husband to touch her in 3 months.
I know.
And I have been passionate since since I started 20 years ago as a massage therapist about the importance of touch. Touch deprivation is real.
Oh yeah.
People become anxious, people become angry, people become violent. And I think some of what we're seeing right now is a symptom of that.
Because you look at how depleted we were even before quarantine, right? Because, just some of the, newer information in the last 15 years that I learned about touch, like, oh, so you require, 10 hugs a day, and the hugs need to be a minute long for you to, feel that, to let down all the good hormones that you need, and to feel that. And then if you are deficient in any way, if you're ill, then you need more than 10 to 12 hugs a day in order to, because your skin needs to be touched. You need to be held. You need a little bit of that compression from another human being. So like knowing that information, and then what we've done to families. And we have to be safe. And I'm not saying we shouldn't be safe, but it's also like, oh my gosh, we have removed so much of what we need physically, and then also the pushing of help. You're right. Like the whole village is outside the door trying to figure out how they get in, how we let them in, and everybody's struggling quite a bit.
They really are, and at this point, frankly, I'm more worried about the emotional and long-term effects of that than I am about the disease.
Yeah.
It's going to do what it's going to do. It's going to run its course, and that's what it's going to look like. But people are going to survive and not be the same, and probably not for the better.
Yeah, it can be really scary. Well, I think we've gotten to cover quite a bit. I'm so excited that we got to talk about so much of this. And I think, back to Elizabeth's question, when we're talking with other providers, because I think that is something, and I'm so excited to see more and more OBs, more and more pediatricians who are encouraging families to seek out chiropractic care. So I know just in the the 23 years that I've been doing this, where I've seen, okay, so when I first started teaching childbirth ed classes, people were like, a chiropractor, why would I do that? And now, mostly half the class has established chiropractic care. And in our moms groups, it used to be that no one was taking their baby to a chiropractor if they were having breastfeeding issues. And we have more and more of that happening. So there's always someone who can talk about it and normalize it. But if you were to, if you had, which you do, have a few minutes to say to those providers out there, like, in terms of helping them, reach across that bridge, what would you say to them? Like other providers who might not have, have started encouraging chiropractic care. What would you offer to them as a way to like take that step?
It sounds strange, but it's the first thing that comes to mind is I can help your most annoying patients.
Yeah.
Yes, I can help the pain point.
Because they cannot help them. These are your patients that are calling you every other day because they hurt, they still hurt, and you still have nothing to offer them.
Yes.
These are the patients that you're like, it's Sally again.
Oh, yeah.
She still hurts. And we told her she just has to deal with it. Or, they're trying to discourage doing things like taking the NSAIDs now because we aren't sure how they're going to affect babies long term. They are running out of drugs they can give their pregnant moms, which is really the only Band-Aid they've ever had.
Right.
And so let me take that problem patient off your hands. That patient that you just don't know how to help.
That's such an excellent, that's so excellent, Dr. Garrett, because it's like, let me help you with the pain in your, relationship with your patient. I can help with this piece. And that's just really key.
Because I don't want to manage their pregnancy for them. I really don't. I don't, their patients have chosen their providers based on how they feel they want to be cared for.
Right.
And that goes back to, I don't care how you choose to have your pregnancy and birth. And I think some providers are a little worried about that. Right. There are some chiropractors who will be like, oh, you're going to have an epidural. You shouldn't do that. I don't care. Oh, you should birth this way. And I really don't care. And I think there is some fear from providers that we're going to want to take that over. I don't want that. I want to really just help the mom be as healthy and happy as she can be. And the healthier and happier she is, the more you can focus on taking care of her pregnancy that she needs to.
Because you're staying in your lane. You know what your lane is. You know what your OB's lane is, or what the OB's lane is, what the pediatrician's lane is. And I think that that's key, that, you know, kind of like, I mean, when we talk about mental health, and we talk about, you know, having an understanding, like I'm peer support, so I'm in my lane. Elizabeth is clinical support, she's in her lane. And, you know, you have a deep understanding of how our body needs to be in alignment. That's your lane.
And I think that, yes, there is overlap. And I also really respect that everybody's lane has something to offer.
Yeah.
You know, when you had that traumatic neck injury, I'm pretty sure you went to your MD first.
I did, because I went to a hospital first, and then referred me to my doctor.
You went and made sure that, you know, you hadn't had, you know, I don't know the extent of it, but you went and made sure that there was something that was safe to live with.
That's right.
You know, you went and ruled out all what I call the big scaries.
Yes.
You know, and you did all that. And if you had the big scaries, I guarantee you would have let the MD treat you, not your chiropractor. You know, you have a spinal cord injury. I don't want it.
Right.
When it's acute.
Yeah.
You know, if people have looked at, I'm like, if I have cancer, I want the surgery, I want the chemo, I want the radiation, and then I want the nutrition and the chiropractic and the acupuncture to get me over it.
Yeah.
You know, I want the Western medicine to do what it does well. But it doesn't do everything well, and pain management is one of them.
Right. And that's more of that village, that whole person, and using, you know, all the different support options that we have available to us. And we don't all need all the different support. Maybe we just need one or two of them. But that's the beauty of it, is there is choice and there are options. And what's wonderful about the practice that you're in is that everybody's working together to support the mom and to shine that spotlight on her, which is what, as you know, what Elizabeth and I are up to is, let's talk about the moms. The moms matter. Let's focus. You know, if we get moms healthy, supported, and, you know, help her stay there, we know that's better for the whole family. We know that's better for the whole world. And so, you know, that focus on let's keep talking to mom, asking mom, and then shining a spotlight on all the support services that are, you know, available to her. So we're just so grateful to have you here with us today. We're getting close to our wrap-up time. And I didn't know if we had any more Elizabeth questions that you have. I'm not really watching the feed because it's so distracting to see if there are questions.
A good place to wrap up. It's just a good reminder that chiropractic care should be in everyone's referral practices. You know, like it's just, there's a collaborative way that all the providers can work together, and chiropractic care is one of those ways.
And I do think some of the providers and some of the moms, one of the reasons they're hesitant is a lack of understanding. And so the more we can talk about it and they can, you know, understand it, I think that that's really helpful. And you're right, you know, Dr. Garrett saying that not every chiropractor practice is the same, just like not every OB practice is the same. Right. Not every mental health provider practices the same. So, you know, talking with a couple might be helpful, you know, and getting to get an understanding. But yeah, it is an excellent option. Well, I don't know if you have any final words for us, Dr. Garrett, before we wrap up.
This has been fun. I appreciate the opportunity to do this.
Well, I'm
going to post a link to the Heartland Approved Providers Registry so folks can find your contact information if they want to get more information about your practice or contact you for services. So I'm going to do that right now.
Awesome. Thank you.
And we're just so grateful that you could spend time with us today. We know you're busy. We so appreciate it. And we will, like I said, Elizabeth will be posting that link. And it's just so wonderful. I hope this spurs lots of more conversations about chiropractic care and the options, and also about the co-located services that, you know, that your practice has. And we'll also put that in our links too, so we make sure that people know how to access you. So thank you so much for being with us today.
Thank you.
We'll sign off, everyone. Stay well, stay healthy, and we'll look forward to being back here in every other week. We're here live with another provider. See you all soon. Bye-bye.
Thank you.